Welcome. This is Catherine Lim, and I will be giving a presentation about animal assisted therapy. Animal assisted therapy is a type of hospice care that employs animals to aid, guide, and improve individuals who have mental, physical, or emotional distresses. This therapy covers the at-risk population of depressed patients, veterans, children with autism, traumatized individuals, and patients who have just completed a critical surgery. While the therapy is in session, the animals are supervised by qualified social workers, counselors, and therapists. The companionship between the individual and the animal has positive outcomes as shown in a study carried out by researchers of the Geriatric Institute. In their study, they populated older individuals who have various health hindrances such as dementia. On the far right, you can see that people with dementia improve their overall mental and physical health after being acquainted and treated with the animal. Some of the enhancement they progress towards are being more social, having longer conversations, and a reduced behavioral disturbance. The next slide also shows fascinating evidence that after being exposed to these animals, these individuals have lower blood pressure and stable heart rates when there is mental stressor. There are different types of animal-assisted therapy, such as canine-assisted therapy, equine-assisted therapy, and pet therapy. The sole purpose of introducing these animals to the targeted population is that the animals communicate by empathizing with humans, and they're not judgmental or threatening. They are accepting of who the individual is as a whole and is always there to help the individual get back to their feet. Let's talk about depression. Depression derives from a biopsychosocial circumstances that are not in favor of the individual. The individual has gone through an emotional stressor and is not motivated to do anything, even taking care of him or herself, completing the basic needs such as washing or eating. When the individual is introduced to, let's say, a dog, then there is hope and encouragement for the individual to realign their daily routine activities and start their day. People always say, love yourself before you love others. But in this case, loving others can return the favor of helping and loving yourself. Taking care of another life is a reminder that these routines were once the individual's routine. Even if the individual is still, there is a visceral connection with a dog. There is an internal dialogue between them that livens the individual, gives stability and comfort. The silence is one way of many ways of communicating, and it never fails to give the ultimate support for the individual. Moving on to the benefits, there are 3 categories that improve the overall health of the individual: mental, physical, and emotional. Mentally, there is a decrease in anxiety and depression, an ample amount of tranquility, and increments of self-reflection and pause. There is also better focus and attention, self-esteem, and self-control. Physically, the therapy lowers the blood pressure and limits the number of medications used, releases phenethylamine, and decreases the physical pain. Emotionally, there is an improvement of positive attitude, sense of security, confidence, and resilience. All of these benefits from the animal assisted therapy is for the wellness of the individual, and it shows great promise. The progress that the individual is making enhances their life little by little and eventually enriches their surroundings as well. The human and animal bond is universal, and it grounds the individual in the present moment to witness and experience unconditional love, hope, and resilience. It also impacts the mind to be more strong and the emotions to be stable. The relationship between the animal and the individual serves a balance to each other of their lives and proves that there is an immeasurable friendship between them. Thank you for listening to my presentation. I hope these slides will touch upon everyone's hearts and mind that treatment is not limited only to medical practices.